Life expectancy is going up, but the number of years that we remain healthy is not. Doctors say in Singapore about 8 to 10 years of our lives are actually spent unwell. And when we're old and sick, the costs just go up.
When an old person gets in, they may be projected to stay in, like, say, X number of days for a procedure. But then there are complications, and sometimes they are frail to start with, right? So the length of stay is generally longer.
The amount that you spend on your care goes up. For example, you have to employ a helper, you end up having to use diapers, adult diapers.
We can try to keep healthcare costs affordable by staying healthy, so we spend fewer years in ill health. Often it's also about our choices for treatment.
Let's take fever, for example. You can choose to go to a hospital A&E, and you can insist that you want to be admitted, but then it will cost a lot. But if you say, well, I have a fever and I think I'm okay, I'm otherwise well, it's just runny nose. In many countries, people stay at home. They just take something to help with the fever. It costs next to nothing to do that.
On a broader level, Singapore has taken steps to bring care to the community to reduce the strain on the primary healthcare system.
The CHAIRS program enables you to not just go to polyclinics, but to go to your GP. But then how about those who can't make it to the GP clinics? We have also the next one, which is mobile clinics. We have a bus that actually moves around and can come down to your HDB flat.
This mobile van complements the efforts by charities like Tai Hwa Kwan and NTUC, who are running home-based services.
We will park at the bottom of the HDB flats, and the grassroots leaders are going to look out for the seniors who are at home and who need home care, and to see whether they can just bring them down to the void deck. If necessary, we can also go and visit you at home.
It's a very Asian desire to be with loved ones in health and sickness.
I believe China, at least 80%, I believe, will be home-based. Family life or the value of the family for Asian or for China is quite important.
Being with the family, therefore, results in mental well-being.
Psychologically, they're also better off at home, actually. So some patients in the hospital, they will refuse to eat, they will refuse to move, but they go home, they will do it.
But are all patients suitable for home care?
They should be stable enough to stay at home and not requiring hospital type of service like IV injections, X-ray. They are just very disabled, dependent. They couldn't walk on their own. So they are mainly bed-bound.
Home care may also be cheaper for these patients.
A private nursing home can cost you 4,000, 5,000, 6,000, or even 9,000 a month. If you stay at home, you just renovate your home, put in a hospital bed, for example, and some hospital furniture. You get a trained caregiver, pay them about a salary of 600-700 a month, plus all the insurance, about maybe 1,000.
The elderly, who need a higher level of care, can also choose to be treated at home.
Like, for example, patients who are on ventilators, right? Or they are very, very frail in the sense they are sort of a bit unstable to some extent, yeah? But can be transitioned to home if they have high level of nursing care.
Compared with a hospital stay, the cost of converting a room into a high dependency care unit might be a better financial choice.
You need oxygen and all that, all right? And just equipment costs, setup costs, manpower costs, something to the tune of maybe, say, 15,000 a month if it's round-the-clock nursing, yeah? But if you compare it to staying in a hospital, even a private hospital, say in a general ward, it may cost you $2,000-3,000 a day.
The quality of care is also comparable to what patients get in a hospital.
The home hospital program concept, which we are running in the US right now in multiple hospitals, it is proven that the quality of care and safety is exactly same as what the patient would be treated in the hospital.
And with the help of technology, doctors can monitor a high-dependency home care patient remotely throughout the day.
We can be on call by telephone, and by today's technology, WhatsApp, messaging and things like that. And for my own patients, for example, we actually do message a lot, right? So the nurses will have concerns and they will text us, it's urgent, they will call us and then we will respond.
Technology has evolved so rapidly in the healthcare space that it can now do much more than just monitor an elderly patient's condition. Digital therapeutics is a field in digital health that analyzes real-time data from patients to predict adverse medical events.
Every day from a single patient, we collect over 5 million data points. And we monitor these patients over 12 weeks, and imagine the amount of data we collect from every patient. That needs to be leveraged, and that cannot be directly sent to the clinician because they'll just be overwhelmed. They just need to know information which they can act on.
Bioformist digital solution helps healthcare providers better manage their patients with heart failure, reducing the need for them to be readmitted into hospitals.
Let's just say a patient gets discharged, a patient is prescribed medicines, and along with the medicines, they also prescribe a digital solution. Patient goes home, starts wearing the sensor, mobile app, all the data streams to the analytics engine, which is FDA cleared. We do two things. One is predict exacerbation or heart failure events almost 2 to 3 weeks in advance. And second is how do you intervene? So we use our treatment algorithms to optimize dosage. Patients are on optimal dose, they're improving their functional capacity, quality of life, and overall health outcomes.